My dad has hair on top of his head, but it's not a lot. So I would have always had hair, but it would have thinned and thinned and thinned to a point that, you know, I would have shaved my head anyway because I think it looks slightly better than a comb over. And that would have had a negative effect in that from a career point of view, it would have restricted some of the roles I could do. From a personal point of view, you know, I would have been a bit gutted. I'm not going to deny it. You know, I've always liked having a full head of hair. I've had it all my life. And I think, you know, if I hadn't done something at that point, what probably would have happened is in 5-6 years' time, the follicles which I had at this point, which were healthy and able to be, revived, probably would have, you know, gone past their sell-by date. And that's when I would have been looking at, you know, a hair transplant. Basically, I'd never thought about it because I used to have slightly longer hair on top. So I'd never noticed a bald patch or anything like that. But then I started work on a TV show called Hollyoaks, and very kindly, on day one, they decided to shave my head. And about a week later, I'd actually booked to go on summer holiday with my wife, and off we went into the nice sunshine in Italy. And I suddenly realised how sunburnt I got on my head. I went and sunbathed, as I always do, all day. And literally, I do a flop and drop holiday. I literally take a book and go and sit on the beach and read. And got back, and, you know, it was a little bit red on my arms, a little bit red on my face. I was like, oh, that's fine. Got in the shower, and it was literally like Armageddon had taken root into my head. It was incredibly painful. And, you know, so then for the rest of the holiday, I was there putting suntan lotion on my head. So essentially my treatment process consists of once every fortnight having a 40-minute laser session. That's where I come to MHR Clinic, I sit in a very nice room, and I read my book for 40 minutes. And when I say laser, it's not getting zapped. It's just literally you're sitting there underneath essentially a light. That's the first part. That's the most inconvenient part because that's the bit where you have to leave the safety of your own home. The rest of it is essentially wake up in the morning, have a shower, wash my hair. I have to use a different shampoo to what I used to use. So this time I use a shampoo which is a DHT blocker. Then I use, after I've had my shower and I've dried my hair, I use a conditioner which you put in your hair. And then you put in a ointment, which is essentially this one here. So that's basically my morning, as well as having a quarter of one of these pills. That's my morning process. Then in the evening, I have to put the solution back in my hair, as well as taking 3 herbal tablets, zinc, milk thistle, and I'm cribbing it, something else. Haven't got my glasses on. So that's it. So literally my hair restoration treatment is laser once a week for 40 minutes. And then apart from that, taking 3 1/4 pills and putting hair solution on my hair twice a day and washing my hair. It's quick, it's easy, it takes no time at all. Within literally a day, it was such a part of my daily process that it doesn't even occur. Even on a Friday night when I'm blotted, I still remember to put in my lotion. It's such a part of my, you know, daily routine now. So it's not difficult, it's not intrusive, and it's easy. The thing with the treatment I'm getting for my hair is that it's not something I can stop. If I stop now, it will go back to how it was, and as I age, will get worse. So, you know, I had to make a commitment to the treatment. Now, whether that's an issue, no, it's not. Because it's, as I said, the treatment itself is so simple. It's essentially what I do anyway on a daily basis, but substituting one shampoo for another shampoo, rather than putting wax in my hair, putting a lotion on my hair. It's such a easy thing to do. I cannot see why, I mean this hand on heart, there is no reason why anyone cannot do it and would see it as an issue or a struggle. It's so simple, it's so easy, it's so quick, and it has absolutely no bearing on you, your time, or your lifestyle. I mean, I'm riddled with issues. I have ankylosing spondylitis, Sjogren's syndrome, God knows what else. So I'm already taking about 30 pills a day. So taking an extra 3 1/4 was genuinely not hard. Treat it. I mean, what the other thing people got to remember is the 3. I mean, that's a slightly more medical tablet, if you like. The other 3 pills are herbal remedies. Milk thistle, great for your hair, great for your liver as well. So I can drink more. Zinc, great for your hair, makes you more fertile. So with my initial consultation with Craig, it was a case of walking in. I'd come in expecting him to say, yes, you need a hair transplant. And, it's going to cost this much. This is when we can fit you in. This is the process you can expect. Because that's what I'd been told by the people. And when I came in to see Craig, it was literally a case of shaking hands. And pretty much the first words out of his mouth was, you don't need a hair transplant. What you need is herbal medication laser treatment. And half of me was like, brilliant, that's great to hear. But then half of me was like, oh, I'm not sure I believe him. But what he then did is he got out some of his equipment, which takes up like extreme close-ups of your follicles and on your hair, on your head, and did readings and measurements to show the science behind it, if you like. So it wasn't just a kind of like sticking your finger in the air and seeing what he thought. It was it was backed up by science. And sure enough, took his camera, put it against my scalp, and did read the health of the follicles. And it was even apparent to me, who's a complete and utter layman, that you could see all the follicles were healthy and alive. The one thing that was wrong with the healthy follicles was that they were producing 2 or 3 hairs rather than 3, 4 or 5 hairs in certain areas. I was completely prepared by Craig to know what to expect. It was going to be a 6-month thing before the results really started to show. And yes, you do catch yourself checking in the mirror. And I'll be honest with you, I took a photo before I started, and I've got photos from now. And if you'd sat me down any day during the process and say, is your hair thicker now than it was yesterday? I would be like, I have no idea. But if I was to have a photo of me before it says your hair thicker than it was here, I'd 100% say yes. So, within under 6 months, I've seen a notable difference. And that's me. And that's me being infinitely more picky than anybody else probably would have been. A lot of people would have been like, oh, you don't need it. But I was like, well, I do, because I want to do the prevention rather than the curing side of it. I want to prevent it so it doesn't get to a point where I have to have transplant. I think one of the big problems we have at the moment is that most people aren't aware that you can have preventative treatment. I think one of the issues is that people who are going through hair loss or who are hair thinning, like in my case, think literally your only answer is to have a hair transplant. And, like people of my age, they probably think back to Russ Abbott back in the 80s when it literally looked like somebody just plugged something off a squirrel in him. And, there is that slight sense of dread. First thing I would say is FUE implants themselves are now absolutely brilliant. And when they're done right, the results are incredibly natural and brilliant. Thankfully, I didn't need that. But I think like most people out there, I didn't realize that there was another option. I thought it was literally a case of all or nothing. I thought you couldn't have a hair transplant until you'd lost your hair. In which case, that would have been a bit kind of like, because, as I said, you'd walk into a restaurant 1 month and you'd be bald as a coot. You'd walk in 6 months later and you'd have a full head of hair. They would know what you'd done. Now, I shouldn't be embarrassed that was the case, that I feel like that, but I would have been. More importantly, though, it's finding a treatment which isn't in the slightest way intrusive or anything like that. It's completely natural. I genuinely feel the treatment I'm getting for my hair now is exactly the same as me going to the gym. It's an ongoing thing, whereas I go to the gym for the health of my body and the way I look. This is exactly the same. I have the treatments from MHR to keep my hair healthy and also maintain the way I look. I mean, there is a slight question: is this relatively new industry not making this treatment, the preventative treatment, readily available? It wouldn't surprise me. It is a new industry. There are some sharks out there who are looking for a quick buck. Now, the quick buck does come from, or at least the quick buck, but certainly the more income comes from FUE transplants. It is a far more expensive treatment. And also, it's not one which depends on a huge amount of face-to-face time. It's kind of like initial consultation, treatment, maybe a follow-up a few months later. That can be all that some of these people are providing. The difference with MHR is, I know for a fact their FUE transplant pre-care, post-care is a lot better than that as well. But also, they provide this service, which is the preventative side of things. It's not the biggest earner for MHR. I'm well aware of that. I do my maths the same as anybody else. But at the same time, you are given as much time, as much care, and as much guidance as anybody else. I'm an actor. Despite misconceptions, we don't earn that much anymore nowadays. And it's not it's not like you have to go and take out a mortgage to pay for this. It's an ongoing treatment. it's probably less than a lot of gym memberships. You know, so why not buy yourself some trainers and go for a run rather than going to the gym and get hair restoration? You know, which would you rather have? You can have both. It's not, you know, so cost ineffective that it's impossible. I'm so chuffed with the results I've got. I mean, I'm still in the TV show, so they keep shaving my head. And, you know, I'm able to sunbathe now without getting sunburned. No, to be honest, I am really, really pleased with it. And what I really like is it hasn't been, you know, like this big dramatic before and after, because it's a gradual process. It looks completely natural because it's not an artificial remedy. It's one where basically I came to see MHR and they gave me back the head of hair that I had when I was 18 years old. So it's not something else being put in place. It's a completely natural process of bringing me back to, you know, essentially my prime, I suppose.